Your belly isn't fat, it's broken posture, and I'm going to prove it to you in the next 60 seconds. Most people spend years doing crunches, cutting calories, and buying expensive supplements, all while completely ignoring the real reason their stomach sticks out. Here's the truth. For the majority of people, a protruding belly has nothing to do with body fat. It's caused by a shift in your pelvis and lower back, and until you fix that, your stomach will keep getting worse. And the worst part? If you leave this untreated, you're not just dealing with looks, you're setting yourself up for chronic lower back pain that can take years to go away. Today, I'm going to show you exactly 4 exercises that will fix your posture, reset your pelvis, flatten your stomach, and eliminate that nagging back pain. No gym required, no equipment needed, just 10 minutes a day. Let me show you what's actually happening inside your body. Picture a side view of your skeleton. In a healthy posture, your pelvis is perfectly level, like a bowl sitting flat on a table. Now, because of certain muscle imbalances, that bowl starts to tilt forward. When it tilts, your lower back curves excessively inward, a condition called hyperlordosis. When your lower back arches forward, your abdominal organs have nowhere to go but out. That's your belly protruding, not fat pushing through, but your organs being physically displaced by your own skeleton. And if you do carry extra weight, this makes it look dramatically worse, sometimes 2 or 3 times as prominent as it actually is. But here's what really should scare you. When your lower back is locked in this forward position, the pressure on your vertebral joints skyrockets. The cartilage wears down faster. Arthritis develops earlier. Pain becomes your constant companion. So what actually causes the pelvis to tilt forward in the first place? One word: imbalance. Certain muscles become too tight and too short, while others become weak and underactive. On the front side of your body, 3 muscle groups are the main culprits: your quadriceps, your sartorius, and your hip flexors. When these muscles shorten, they pull the front of your pelvis downward. And if that's not enough, there's a 4th muscle on your back, the erector spinae, which runs along your spine. When it tightens, it pulls the back of the pelvis upward, tilting the whole structure even further forward. Meanwhile, 2 groups of muscles that should be holding your pelvis in neutral position have gone completely offline. These are your abdominal muscles and your hamstrings, the natural stabilizers of your pelvis. When your core and hamstrings are weak, they can't counter the pull of those tight hip flexors and erectors. The pelvis tips forward, the lower back arches, the stomach pushes out. The pain begins. The fix is straightforward once you understand the problem. We need to do 2 things simultaneously: stretch and release the tight, overactive muscles, and strengthen the weak, underactive ones. When we do both, the pelvis naturally returns to neutral. The excessive lower back curve disappears, the stomach flattens, the joint pressure is relieved, and the pain fades. We're going to use just 4 targeted exercises to make this happen: 2 stretches for the tight muscles, 2 strengthening moves for the weak ones. Simple, effective, backed by anatomy. Exercise 1: hip flexor and quad stretch. This first move targets your hip flexors, quadriceps, and sartorius, the 3 tight muscles on the front of your hip that are tilting your pelvis forward. Stand in a split stance, 1 foot forward, 1 foot back on your toes. Keep your back straight and place your hands on your hips. This position alone should feel stable and comfortable. Now shift your hips forward until you feel a gentle stretch along the front of your back thigh and hip. Don't force it. Stop at the point of mild tension. Then slowly return to the starting position. What you're doing here is extending your hip joint through its full range. That's what releases the tightness in these deep hip flexors. You're not just stretching a muscle, you're restoring joint mobility. Perform 20 repetitions on each leg, then switch and do 20 more on the other side. That's 1 set. Complete 2 full sets per leg before moving on. Exercise 2: spinal erector release. The second exercise targets the erector spinae, that deep muscle running along your spine that's been pulling your lower back into that painful arch. Lie flat on your back, bend both knees. Slowly lift your legs and wrap your hands around your shins, pulling your knees toward your chest, as close as comfortably possible. As you bring your knees in, you'll feel your lower back gently press into the floor and your tailbone lift slightly. That's the stretch working. You're elongating the erector spinae and decompressing the lumbar vertebrae. Breathe out as you pull your knees in. Breathe in as you lower them back down. Never hold your breath. Rhythmic breathing is part of what makes this movement effective. Go as far as your flexibility allows, no forcing. Aim for 20 repetitions per set, 2 sets total, with a 1-minute rest between sets. Even if you can only manage 10 at first, that's perfectly fine. Strong muscle sign exercise 3. Core activation, leg raises. Now we shift into strengthening mode. Exercise 3 targets your abdominal muscles, the ones that have gone weak and stopped holding your pelvis in a neutral position. Lie on your back. Place your hands slightly wider than shoulder width with your palms flat on the floor for stability. Bring your knees together and press your feet flat on the floor. From here, lift both legs together as high as you comfortably can, then slowly lower them back down and return your feet to the floor. That contact with the floor at the bottom is intentional and important. You'll feel your abdominals engage immediately. And notice, this is not about getting a six-pack. This is about reteaching your core to do its real job, stabilizing your pelvis and keeping your spine neutral. Exhale as you lift your legs. Inhale as you lower them. Keep the movement controlled. Slow on the way down is where the real work happens. Target 15 to 20 repetitions per set, 2 sets total. If you can only do 5 right now, do 5. Consistency matters far more than volume. Over time, this will get significantly easier. Strong muscle sign exercise 4. Glute bridge, hamstring and glute activation. The final exercise activates your hamstrings and glutes, the other half of your natural pelvic stabilizers. These muscles have been chronically underused, and it's time to wake them back up. Lie on your back, hands slightly wider than your shoulders, palms down, feet flat on the floor, slightly wider than hip width. This base gives you stability for the lift. Press through your heels and lift your hips off the floor until your body forms a straight line from your knees to your shoulders. You should feel a strong contraction in your glutes and a stretch along your hamstrings. Hold the top position for just a moment. Feel the squeeze. Then slowly lower your hips back to the floor. Let them fully relax at the bottom before the next rep. That full release is part of the technique. Important, don't hyperextend at the top. You're not trying to push your hips as high as possible. The goal is muscle engagement, not maximum range. A straight body line is enough. Inhale before you lift. Exhale as you rise. Inhale slowly as you come back down. Aim for 15 to 20 reps, 2 sets, with a 1-minute rest between sets. Your training plan. Here's the program. Do this 4-exercise routine every other day. That means 3 to 4 sessions per week with recovery days in between. Muscles need time to adapt. Training every day will not speed up the results. Commit to this for 2 to 3 months. That is the realistic timeline for your muscles to relearn their positions and lock in the new pelvic alignment. Postural change is a process, not an overnight fix. What does a session look like? Exercise 1, 2 sets times 20 reps per leg. Exercise 2, 2 sets times 20 reps. Exercise 3, 2 sets times 15 to 20 reps. Exercise 4, 2 sets times 15 to 20 reps. Rest 60 seconds between sets. Total time, under 15 minutes. What to expect? In the first 2 weeks, don't expect dramatic visual change. What you will notice is reduced muscle tightness in your lower back and hips, and better ease of movement throughout the day. By weeks 3 and 4, your posture will begin to shift noticeably. People around you may comment on how you're standing differently, taller, more upright. Your lower back discomfort will start to ease. By months 2 and 3, the visual results become clear. With your pelvis in neutral alignment, your stomach will sit naturally flatter, not because you lost fat, but because your skeleton is finally in the right position. Mistake number 1. Skipping the stretches and only doing the strengthening exercises. Both sides of this equation are equally important. Strengthening weak muscles without releasing the tight ones will create more imbalance, not less. Mistake number 2. Training through pain. Mild tension during a stretch is normal and expected. Sharp or shooting pain is a signal to stop. These exercises should feel challenging, but never painful. Remember, a protruding belly caused by posture doesn't respond to sit-ups or calorie restriction. It responds to corrective movement. 4 exercises, every other day, 2 to 3 months. That's the entire prescription. If you found this helpful, hit that like button. It genuinely helps more people find this content. Drop a comment below telling me how long you've been dealing with this issue. And make sure you subscribe and hit the bell so you don't miss the next one. Thank you for watching, and here's to your good health. Goodbye.